This is Stelt on Health with Mario. She began her career on the front lines of patient care before pivoting into strategic and operating roles throughout the Fortune 500 at companies like Merck, Pfizer, Medco Health Solutions, and Cardinal Health. Today, she is a managing partner in a $25 billion global private equity firm where she leads their healthcare investment strategies. She's also an adjunct associate professor at Columbia University Mailman School of Public Health. Meghan is on the board for Tenet Health, Senior Link, ABB Optical, K2 Health Ventures, and Destination Pet. She's the author of the recently released book, Ascending Davos, A Career Journey from the Emergency Room to the Boardroom. She lives in the West Village of New York and Naples, Florida, with her husband, macro strategist Mike Darda, and their Weimaraners?
Yeah, Weimaraners. Who's behind
Weimaraners.
me?
Okay.
Yeah, who's behind me? Yeah.
Yes. She lives in the West Village of New York and Naples, Florida, with her husband, macro strategist Mike Darda, and their Weimaraners. Welcome to the first episode of Stelt on Health, Dr. Meghan FitzGerald.
Hi, Mario. How are you? So nice to be on the first episode. This is so exciting.
We are beginning boldly with a incredible individual with some great thoughts, and Meghan, it is a pleasure to have you join us.
Oh,
So I'd like to start off our conversation by asking you a bit about personal health. You've gained some valuable insights learned from your study about the impact of increased status on one's personal health. What have you learned in your career, and how has that prepared you in your ascent?
yeah. So I think really my, personal brand and message for everyone is that health is a form of wealth, and you should not figure that out too late in life in your career. Many people are often focused on their pay package, getting that great title, and then they find out they're working in an unhealthy environment for a toxic boss or somebody that when the going gets tough with your health, and it will, especially with the sandwich generation, you have people raising kids, but now you're also taking care of your parents and seniors, that you're not in an environment that supports your health. And I did some study of executive women. I also looked at men on trading floors and firefighters to kind of shape the study about people that work in really stressful environments, and often have not a lot of control of that stress. And what I found in my study is that 48% of executive women could not see a doctor due to workload. And so I think it's a real issue. And I think a lot of people working in the corporate environment, especially the younger generation, are putting a premium on health. And they're demanding that their health is treated as part of the benefit package.
And you have a specific mindset that you shared in the book, and that I believe is somewhat of a mantra for you. Can you tell our viewers about this?
The GSD.
Yes, it is.
Yeah, the get shit done. So I hope we don't have to edit that, but I believe that you wake up, show up, give your best performance no matter how remedial the task. That every day you have an ability to just do your best work and leave a job, an assignment better than when you found it. And I have found that doing that, that becomes kind of the hallmark of your work ethic and style. And you get promotions and you get top jobs, and you kind of get to always be around the sun in your organization when you're known for top work.
And how have all these experiences prepared you for our current pandemic?
Wow, that's a good question. I don't think anybody would honestly say they've been prepared. I think two things in my experience have helped me think about this and teach about the topic. And I also volunteer at the hospital across the street here. So the first is triage. If you work in emergency medicine or you work on the front line, you understand triage. You understand what it's like to manage in a crisis and delegate and focus on the things that really matter. And that has stayed with me during this career. And it's also made me know what, kind of what to focus on in this pandemic. I think the second is I went and got a master's in public health, and then I got a doctorate in public health and epidemiology. So that prepared me to focus on data and the importance of reporting and tracking and good data. And I think regardless of who you are right now, you'd agree the data hasn't been great. So we're constantly changing the death rate. We're telling people to wear masks, then we're telling them not to wear masks. I mean, I think what we've learned in this pandemic is that data really matters, and agreeing on data and not making data about politics really matters. So those are two things I put a value on, and I think that came to me, early in my career from my education and my experience.
And we'll talk a lot more about data and some of those experiences that are currently happening now, and some of the things that we will can envision getting better in the future. But let's take a step back. And I know understanding the nature of a pandemic is really an important step in adequate
Yeah.
population and crisis scenario planning. What did we do correctly, and where could we have improved?
Yeah. So it's such a good question. No one in all the interviews I've done in the last month have asked me what did we do well. And I think as a leader, when I used to manage teams during a crisis, and obviously nothing was to this level, it's often important to reward and recognize what's going well. It's very easy to critique things, and there'll be plenty of critique. There's no doubt about it. But for me, the bright spot in this pandemic has been the front line responders. And when we think about front line, it's the people that are caring for us, the medics and the nurses, the people that are protecting our safety, police, firemen, and then all the people feeding us, all the people that are ensuring that we're able to eat and have good food and have food delivered. And a lot of these people don't get paid a lot to do that, and yet you're asking them to put their life on the line. So for me, the bright spot in this has been how the front line has just risen up and delivered very much, what we saw during 9/11 with firefighters and policemen, running into buildings and saving people. I think there's a lot of analogy to that we're seeing today with the front line. So for me, I think the front line has done a remarkable job. They know how to triage. They've been working with universal precautions, since the 80s. So this is not a group that it's not something they understand. It's more that they were under siege. If you're used to seeing 100 people in your ER and now you're seeing 1,000 or 2,000, that's just the law of numbers, and it makes it very difficult to handle it. But it doesn't change how well they rose up and responded to it. And I think I'm really prideful of our U.S. medical system, and I think it's a bright light. So critique it all you want, but I've been really proud.
And in terms of what and where we could have improved, thoughts on that?
Yeah, so we could have a whole show on that. I think we took public health for granted. I think we took the US medical system, for granted. Our number of hospital beds, per thousand is on the low side when we compare ourselves to other advanced countries. So I think this idea of just in time medical care and that maybe the hospital was a cost center and it's very expensive, we took it for granted. We also took public health for granted. Let's just be honest. Out of every dollar that's spent on healthcare in the United States, 3 cents goes to public health. 97 cents goes to medical care. So right there, it lets you know that maybe we took this really important field for granted, and I don't think we're going to do that again.
And that's an important segue to a topic I wanted to cover for all of our viewers that don't understand the nuances and the differences between public health and their own medical care. So, Dr. FitzGerald, take us back to basic public health 101. Can you share how our nation's public health system operates and how this beautiful system, which you have just said, has been kind of overseen and taken advantage of almost? How is that separate and distinct from the system that provides most people's medical care that they know of from some of those frontline workers?
Yeah, so right out of a book, public health deals with the health and perspective of populations. And medicine and medical care deals with the perspective of the individual. So as a result, public health puts an emphasis on prevention, diseases, health promotion of a population. And so I think now we're seeing we have to take care of the population. And many of the things we're talking about in the news, whether it's, track and trace vaccination, medication, getting good data, forecasting, that's all the products of public health. That's the business of public health. So I think now for the next foreseeable next few years, maybe even the next decade, you're going to see a shift that public health is just as important as medical health and treating the individual, because we found out what happens when 1 million people are infected and we weren't prepared for it. So that's really the difference. And I think that difference is now meaningful as we think about policy going forward to treat a population and not just an individual. And by the way, it crossed all bounds, race, wealth, state. It was an equal opportunist in how it affected a lot of people.
And you said something earlier that I think leads to my next question. You talked about health being wealth, and that's something that my father has said my whole entire life.
I took it from him, maybe, yeah.
I remember during his actual retirement speech, he shared that, and he said if that's the case, he's been the most wealthiest person in the world. But you recently posted a quote, and this really caught my eye. I had not seen it before, but wanted you to share your thoughts and maybe explain this for our viewers. It said public health is the key to monetary policy. I think we're seeing that play out from an economic standpoint, and certainly with 20 million jobs lost here in the United States. Tell us your take on public health as the key to monetary policy.
Yeah, so my husband reminded me, and I hope I said it the right way. I believe the path to economic recovery is through the US medical system, whereas monetary policy is really the Fed, and that's his area. So he's reminding me that I'm not talking about the Federal Reserve here. So
Sure.
not monetary policy per se, but I think we'd all agree you need healthy workers. We need the population to be healthy before people can get back to work. So I really picked up on this because I wanted to make sure that the $2 trillion bailout focused on the US medical system because that's the front line. So, and right now I'm looking at the healthcare sector is the second best performer in the S&P year to date. And why is that? I think that's because the market knows that part of the solution going forward is healthcare. It's biotech, it's services, it's technology, it's all these things we need to get the economy back on the rails. And you need everyone that works in that economy to be healthy. So I'm going to stick with that. The path to economic recovery is through the US medical system. And I'd like to make sure that the attention and the bailout and the funding goes there.
I want to dig a little deeper into public health and really how it's kind of out of sight, out of mind for a lot of Americans. But Julie Rovner recently published an opinion piece on May 1st in NPR, and I believe it also was on the Kaiser Family Foundation. The title of it was Always the Bridesmaid, Public Health Rarely Spotlighted Until It's Too Late. And being the public health uh, guru that you are, noted influential expert that you are, what were your thoughts on this article and its title?
Gosh, well, she's the expert. And after I read her article, I thought, wow, I have a long way to go. So I'm very humbled by how many people are really good at this job and really good at getting at the story. So I loved her article. I thought she nailed it. And all I can say is she really, put a big spotlight on how it really is treated like a bridesmaid. In fact, I teach at the School of Public Health. And since I'm in private equity and I worked in the Fortune 500 and had some pretty senior jobs, when I tell people I teach at Columbia, they just automatically assume it's the business school.
Yeah.
For the last 5 years, I kind of got a frown like, oh, you're at the School of
Oh,
Public
that, yeah.
Health. Like something went wrong. And now they know. No, I actually look like the strategist that I am by teaching at the public health school. And Monday night was the last night of this semester. And I told the graduating class of students that are getting an MPH and an MHA out of the School of Public Health and Policy that they may just have graduated with the degree of the century, not the decade, but possibly of the century, because it's finally getting its due and we really need them. In fact, right now we need 100,000 track and tracers. We need people to focus on public health more than ever. And I think boardrooms around the country are going to say, where's the public health voice in our company? Where's the public health voice in our boardroom? So I actually think it's finally getting its due. Unfortunately, it took a pandemic to do that, but I think it's no longer going to be, the side degree or that, the person, that you just say, wow, what happened? Are you now going to go back and get an MBA? I think it's finally going to get its due, that it's just so incredibly important. So her paper and a lot of people covering this story way better than me are starting to put it on the map. And I could not be happier. Obviously, I spent so many years getting these degrees. It's like, yes, finally you get it.
No, I agree with you. I think this is the career of the year, certainly with all the jobs that are going to be coming available. And I heard Governor Cuomo here in New York, his conference the other day of how many people they're going to hire and train, and they all need public health backgrounds. So those MPH degrees from Columbia and other schools, certainly in the New York area, are a definite easy opportunity to go and get highly qualified individuals who could go and do this work on the front lines. And this is frontline work. I mean, I equate this to some of those consensus workers that are looking out, the census workers that are going out on the front lines and going door to door to
Yeah.
help count these people. This is literally an on the ground, door to door type job to do that contact tracing. So we need people that know what they're doing and people that certainly are mindful and respectful of all the rules in terms of engagement and what all the data ultimately will mean. But thinking along those same lines, during this current pandemic, there's been a lot of barriers that you, your colleagues in public health have faced. What are some of the most pressing needs currently that are currently being worked through?
I think the first is testing. And I know everyone's so tired of talking about it because it leads the news story every day. But the more testing we do, the more likely we're going to catch outbreaks before they get out of control. And the testing also helps us get a real number around the true death rate. And as you test, you want a low number to come back, and you don't want a high number to come back. You want it to be under 10%, because then you start getting a sense that your population, certainly at the local level, is under control. So right now, I think as of this morning, we have roughly 1.2 million cases, and we have 71,000 fatalities, and some of the fatality rates are looking at around 5 to 6%. That doesn't make sense to me. I would be surprised if it's not closer to 1, and that's because we're not testing at the right level. So we're not getting the precision around the data that we need. And I think there's been two schools of thought on this. One, the White House wants, I think, the testing to be 2% of your population. And then I think I was just looking at Harvard said they want the guidance to be around 500,000 people get tested a day. And so when I look at that, a lot of states are not at that level, but they're on their way. There's like 18 states or 20 states that are at the level of the White House guidance. And then there's like 23 states that are at the level of the Harvard guidance. But then there's a lot of states that would be like Rhode Island. They're above the 2% testing number, but they're below the Harvard metric. So for me, I'm more focused on, if you don't meet either of those metrics, how do you ramp up your testing? I mean, testing is our number one tool to help us kind of diagnose and manage the problem. And I think we're going to get used to being tested all the time. So, you're going to get a COVID test, then you might get an antibody test, and then you might get a test again, and then you might get vaccinated. So this idea of testing is going to be perpetual and the new world. And so we're going to have to get used to it. But to me, that is like the number one area that I would be focusing a lot of my time and attention. And I did apply, by the way, to be a contract tracer down here in Florida. So I have a little bit of a story around that. But I think that the mix of technology and, as you said, Mario, manual, you actually need someone to fill out some of these forms. I know that's not what people want to hear, but a lot of the data and the interviews are manual. I have to interview you and ask you about where you traveled, where you went. And it's really detective work. Where did you go yesterday? Were you around a cluster? Are you wearing a mask? There's a lot of investigative work that goes into me chasing down an epidemic, which or an outbreak, which you see in a lot of the movies is not too far off.
It seems like those have been very well scripted in movies like Contagion, and people certainly have followed.
Ominous, right? Yeah.
So, when we think about the strategies that you've seen implemented that have helped us overcome some of those barriers of testing, and in those states that you mentioned, like Rhode Island, that are somewhere in between what the
Yeah.
White House and Harvard is saying, which strategies have benefited the overall cause and what we're doing here?
Outside of testing, or to get people back to work, or what do you mean
Yeah,
specifically?
outside of testing, what other strategies have you seen that have been implemented that have really helped us overcome these barriers?
I think for me, I've been spending a lot of time focusing on how do we get elective procedures back online.
Hmm.
And I think there was a bit of a misnomer in that, Mario, and that something can be medically necessary, but also called elective. So I'd love to redo the word elective, because when I worked in the ER, everything was elective except if you came through the ER. So anything that was booked was technically elective. So a cancer biopsy, elective; a heart stent, elective. And I think we all agree some of these things are medically necessary, if not medically urgent, but they were put under the caveat as being elective. And back in March, when we put a ban and a hard stop on elective procedures, everything came to a screeching halt. So what I've been focused on now, and what I think is working well, is some areas that we see in New York and Texas and Florida getting these procedures back online. So Mario is called, he's triaged, and it's discussed. Hey, Mario, I noticed that you needed a biopsy. It's been put off for 45 days. Let's get you back in here. And what does that look like? Mario, you're going to wait in your car. You're going to wear a mask. I'm going to call you and tell you when to come in. You most likely will be administered a test before the procedure. You'll certainly have your fever checked. And if you have a fever, then obviously that's cause for concern. You might not have your procedure scheduled. So I've been really impressed, back to the front line, back to the medical people that know how to do this. If we allow the local level and the medical experts to manage this, not only can they triage and give you a safe passage back into the medical system, they also know the capacity, whether they have enough ICU capacity at the local level, whether they have enough supplies and gloves and gowns, nursing staff, medical staff, respiratory therapists to treat you. So I've been impressed at the local level in some states how they're starting to bring this demand back online, because I think a double tragedy of all this would be to suddenly look in that excess death rate that we talk about a lot and find that a lot of people died because the hospital actually had the capacity and had the ability to treat you, but because of a lockdown or a mandate, you weren't treated and you died, not of COVID-19, but you died of something preventable. I think to me that would be a public health travesty. And I think it's finally getting some coverage, Mario, and we're starting to really see the medical system open back up.
And let's stay on that point for 1 minute, because I think this is really critically important
Yeah.
for our viewers to understand, because a lot of numbers are thrown at them, a lot of things that are foreign to a lot of people that are not in healthcare, even for those that are in healthcare, that aren't looking at data or aren't looking at epidemiology. You said we needed to look at real-time weekly excess deaths, not retrospective monthlies. Explain to our viewers in very simple terms, what does that mean, and what are we currently missing in terms of data?
Yeah. So excess mortality, just like straight up definition, is the gap between the total number of people who died from any cause and the historical average for the same place and time of that year. So mortality data in the middle of a pandemic is not perfect. There's disparities. States report at different levels. Connecticut hasn't reported any deaths since February 1st. So that is strange. That certainly can't be true. The New York Times about 10 minutes ago just released a huge piece on excess mortality. So I'm curious about excess death because I want to know who died from COVID-19, and I want to know who died from COVID-19 who was not tested and diagnosed. And then I really want to know how many people are dying of other causes because of an overwhelmed hospital system. And right now we don't get weekly excess mortality. It's really a lag, and it's like a month lag. So you're not getting a really good handle on how many people are dying at home or in a nursing home from COVID, let alone who's dying of something else. So I think this idea of excess mortality is going to be something we're going to dig into and look at and be desperate to get. And like I said, the New York Times and Margot Sanger-Katz this morning tried to get at it by triangulating state level data, their data, and CDC data to see what the excess death rate is. But it's not good. Anyone that tells you they have a good handle on this, I've not seen anything, and I've spent a lot of time looking at this, but it also reflects the limited testing that we're seeing to look at who's actually died of the virus. And then sometimes I suddenly see a spike in a state, and really the spike is just the backlog of tests or the backlog of information that came in. So I think you're going to see a lot of reporting on this, Mario, over the next few months.
The curious link for me, Megan, is when I look at what you've just shared with us about excess deaths and elective surgeries. And these aren't two opposing thoughts. They're a thought that needs to be considered, because you are also talking about people that may have passed that could have had an elective procedure. And I don't want our audience to miss that, because we've talked a little bit about data here and missing data. But a couple of minutes ago, you shared about restarting elective procedures. And I know a few weeks ago, CMS actually released that guidance for how healthcare systems can restart those elective procedures that were canceled due to COVID-19. I think it's going to be very interesting to see how many lives we lost or could have been prevented if those elective procedures had been restarted much earlier. So that'll be interesting if we ever know that number. But
We will. You know what? I'm confident that we will. We have leading indicators. So right now,
true too.
U.S. cancer patients, 25% of them say there's a delay in their care. So come on. I mean, that's a leading indicator to say if 25% of them are feeling there's a delay. And by the way, my brother's one of them. He's younger than me. He's waiting on a cancer biopsy. He's 45 days delayed. he needs to get that biopsy, especially in some of the hospitals and areas down here in Florida that aren't at capacity. They're telling him that they can see him, and now he will get in there and it will be done. But it's personal for me because that's just one story, and I know we all know somebody. So you're right to say we need to do two competing things at once. We need to test, track and trace, get a vaccine, get good data. By the way, all of that has a delay. We're not going to have a vaccine for a year, for sure, a scaled vaccine for a year, even if we put the gas on it in order to like vaccinate the entire population at scale is a year away. But we can't wait for testing and a vaccine to then go treat people like my brother, especially if a local hospital says, I'm good. I've got 30% ICU capacity. I have the supplies. I have the staff. I can see you today. That hospital should be able to make the local call to see people like my brother today. And that's the competing priority. And I think the US medical system can handle doing both of those things at once. By the way, that's public health and medical health being done at the same time, basically.
So, a real specific life example, certainly for you with your brother, and we certainly hope things turn out well with him and his biopsy and his diagnosis. But you cited a recent example in a tweet recently where an 800-bed hospital in Southwest Florida had its census cut down in half to 400. There was no coronavirus disease patients, but also no elective surgeries taking place. And the staff was asked who wanted to volunteer to go home with no pay, so furloughed without any pay. And certainly, I've read several examples of these decisions by local medical systems recently, and was shocked, to be quite honest with you, that these decisions would be made. But I think, as opposed to focusing on what has happened, let's focus on the process going forward. I know we've talked a little bit about those best practices we're learning in Texas, Ohio, Florida, in terms of reopening hospitals. But what is the process for bringing on these medical systems back online, these hospitals back online? And what do you see as some of the biggest challenges to doing so?
Yeah, so I think we've started. So I applaud that. And I know CMS is working, to help. And again, I think at the national level, you give guidance and policy and funding, and same at the state level. But I think the execution has to be done at the local level because, like I said, they can answer all these immediate questions. Have we had a 14-day decline in hospitalizations? What is the virus spread? Is it below 1.1 where it should be? So I think, again, the local doctors and public health departments can answer these things. So I honestly think now that we started, which is great, the biggest challenge is that many people are so fearful. I'm down in Florida, and there's obviously a higher, percentage of chronologically advantaged individuals, not just seniors. They're living a really long time. And just because you're 70, you're not a senior to me. Certainly my mom would correct you, but they're scared. They don't want to go to the doctor or the hospital now out of fear of maybe getting COVID. And we told them to wash their groceries. Don't wash your groceries. As I said earlier, wear a mask. Don't wear a mask. It's been very confusing. And as a result, they're scared. So I've labeled this idea of safe passage, that we have to work together with good information, maybe even telehealth, to video some of these patients ahead of time and explain to them how safe passage might work and why we're going to do everything we can to protect them. And also the doctor having a discussion with them about the risk benefit of coming in now versus maybe waiting a month if it's a total knee replacement, versus maybe something that is a little bit more medically urgent, like a biopsy. So I think for me, the biggest area I'm concerned about is that there is a lot of genuine fear about coming to getting as close as you can to the nuclear reactor, which for many, they feel like is the hospital and they don't want to come. And so how do we carve out areas where affected people can maybe stay in a hospital, but then there's areas where a patient can come in? And I know right now, down here in Florida, a GI center, when they're doing colonoscopies, maybe they had 10 people, in an operating suite. Now they have 5. They're keeping the patients way spread apart. Even during the colonoscopy, the patient's actually wearing the mask. So we're explaining this to patients and making them comfortable that we got them, that we have them. don't worry. We're going to do everything we can as a medical team to protect you and give you the information and the tools you need, whether it's a mask or testing you ahead of time or explaining how this is going to work, and taking your temperature. I think going out of our way with that extra information is going to go a long way to getting people more comfortable to come back. Including not having a waiting room anymore, which I know is something you were kind of retweeting yourself, that's really not a place people want to be hanging out anymore. They never wanted to hang out there
In the
before.
first place, that's true.
Yeah, exactly.
Not where they want to spend their time.
No,
Depending
no,
on what's on the TV and how old those magazines are, though.
exactly.
So I've also had a personal family member that has been diagnosed, has had a biopsy. They were a previous cancer survivor and received treatment, and they are currently going for radiation every day. And what you said is so important here. I don't even think it is optional today, tomorrow, or a year from now. We need to provide safe passage for the care of all patients. It's not just for those chronologically challenged. And my mom would agree with you. That's not
Chronologically advantaged. So if you're 85, you're chronologically advantaged. I want to be very clear, and I hope that I'm one of those people. So my mom's always reminding me. She's actually in her 70s and was taking care. She's a caregiver for someone in their 90s. So could you imagine? So yeah, you're right. So you could be chronologically disadvantaged, but I'd say most people down in Florida are chronologically advantaged. It's a
agree.
cool.
I like that. I like that.
They're at the Apple store in skinny jeans. That they're golfing with crazy handicaps. I mean, people down here are living life. This is not, you're not old and over the hill down here. You're very much hip and alive, which is why I live down here.
That's very true. That's very true. So the story that I was sharing about our personal family member,
Yeah.
they are actually physically waiting in their car, waiting for that call, and then going to their 5-minute radiation treatment and coming right back out. And obviously, they've got all the necessary precautions in terms of their personal protection and the N95 masks and the gloves. But I do believe that crowded waiting rooms, as we're used to seeing in New York hospitals and clinics and doctors' offices, and certainly some major specialty physicians, I think these are things of the past. I know you've had some thoughts as well recently on how we potentially should engage differently in the waiting room, utilizing some potential healthcare innovation and technology borrowed from another industry. Thoughts on that right now, how we can potentially trigger or inform or alert patients that are waiting that they're next.
Yeah. And I hope your family member does well, Mario. Same thing. I'll be
Thank you.
thinking of you as I think of my brother. So we're in this together for sure. So whenever you used to go to a restaurant, right, they handed you that ridiculous beeper that flashed red and they told you
Yeah, yeah.
the time to come. And
The
when I
kids
got
used to pass that around like a hockey puck.
exactly. I don't want to touch it. You
Yeah,
tell me when we're ready. I'll be at the bar.
yeah.
But now, you use Apple will call you and say, we're ready to see you. Right. So I think we've gotten really good on the consumer side and, the restaurant side about telling people just in time dinner or just in time, product. And I think we're going to have just in time healthcare. Like, why do you need to go wait in a waiting room? I think the car right now is the new waiting room. And for people in New York City where they don't have a car, I think we're going to use telehealth. Certainly telehealth can do a lot, right? We can do
Very
the
much so.
front part, we can do the front part of a medical visit with telehealth. And then we can also tell people, we're ready to see you now. Here's your 20-minute window. And we can get you in the queue. So I wonder, just like we're getting used to working at home now, right? So it's going to be a mix. I think even when we go back to work, you're still going to see a lot of virtual meetings because we just got everybody comfortable with Zoom. I think you're going to get people comfortable with not using a waiting room, and it's wasted space, by the way. It could certainly be used to see patients, not hold a bunch of patients. And I think a lot more can be done online. So I wouldn't be surprised if, the waiting room started to kind of dissipate or take on new meaning. And we started doing things with technology, which I think would be great. Because you can also do your pre-billing and your insurance and load your labs. And, this whole thing might be forcing us to do things, more electronically. And we've had a heck of a time with, using EMRs and EHRs. And I think maybe this is now going to be the spark that gets us started to do things differently.
I was on a public health webinar last Thursday through Boston University, and it was really interesting to me that it was being chaired by the head of the public health team, Dr. Galea, up at Boston University, as well as some architects from various areas, both Boston and Toronto, and even how our view of the surrounding areas, of the hospital itself, of the unit, of the architecture of our entire environment may change and may need to change drastically. Certainly, open space offices, as we've come to be a part of in many businesses, those are going to have to change. But specifically, they were focused on the healthcare space, and I agree with you. I think our whole entire environment, as we understand it, the care that we get, the process and the stepwise approach, leveraging telehealth, those e-consultations are going to be critical to our success. And I want to stay on healthcare innovation for a moment, and specifically with regards to our response to coronavirus and what happens next. Healthcare innovation has certainly a wide berth in terms of roles to play. What are some areas that are interest to you, and where do you think we may have some success in terms of innovating to prevent the second wave that's coming?
Yeah, so I think a lot of the innovation right now is happening around public health, um, including all the medicines, right? I mean, biotech and biopharma has really kicked this into high gear,
Like
as you
never
mentioned.
before.
Never before. Unbelievable. And the FDA, by the way, like emergency use authorization, fast tracking things. I mean, I think they really need to be commended processing all of this real time. And so I've been so impressed with biopharma and the FDA and their partnership to get after vaccines and get after treatments in record time. I mean, the remdesivir data, how fast that came out, was remarkable, and I think a best practice. And my hat goes off to all of everyone working in biopharma. So I think there's that area of public health. I love seeing AI and technologists come together with epidemiologists. I'm always making fun of my husband that on Wall Street, there's all these macro economists that are now macro epidemiologists. But I think you're seeing all these groups kind of come together. I'm good at data and AI. You're good at public health surveillance. Can we, apply some AI to that? I think it's great to watch Google and Apple get together to start talking about track and tracing, which is really interesting. So all these uncommon bedfellows are coming together. Competitors are coming together to look at things. And then I think on the other side was the dialogue we just had on medical care and how medical care will likely change. Outside of that, unfortunately, I've been very interested in mental health. I think we're going to set a lot of people back. I think frontline providers are going to have a lot of trauma. I think people that lose somebody to COVID or maybe couldn't get care and they had cancer are going to have a lot of stress and trauma. I think people with addiction um, are not getting the care that they need. They're not certainly not able to go to AA meetings, and they're trying to do that online. And I worry about the mental health of the United States going forward, and certainly people on the front line, the stress and the volume and an inability to save people and managing volumes of people. I'm, as an investor and a public health person, very, very interested in behavioral and mental health going forward. I think it's going to be an enormous area of need, and I really hope that it's an enormous area of innovation and investment. And I'm worried that it might not be, and it's really going to be needed.
No, I agree with you, and certainly it's May, it's Mental Health Awareness Month, and in some upcoming episodes, we will have both the physician and the medical health and behavioral health perspectives come into play on that. But certainly, I agree.
It's also National Nurses Day today. So
It
I think,
is.
I
Well,
think of my grandma being a nurse during the war, my aunt being a nurse during 9/11, and now I've got two little cousins working on, I say they're little because they're so much younger than me. They're working on the front line now as COVID nurses. So it's amazing to look back at the last century of crisis and pandemics and national disasters, and to watch everyone, you definitely know someone that's a nurse. So go out of our way today to say congrats to all of them and how much we appreciate them. I think it's National Nurses Day every damn day. So
it is. And it's very interesting because I remember after 9/11, we had the great opportunity to thank every member of the armed forces and law enforcement, as well as some of those EMTs and paramedics in New York for all of their service. And there wasn't a time where I probably in the last 20 years have gone through an airport where I haven't said thank you to a
me
service member.
too.
It's
Me too.
exactly what we do, and it's exactly the way we should show our national pride. But I think we owe it to our nurses. I think we owe it to our pharmacists. I think we owe it to those physicians on the front lines and those folks behind the scenes that continue to make those healthcare workers that are on the front lines sustain their abilities. Those individuals that are sanitizing the rooms in the hospitals, those individuals that are in the medical supply industry, your former colleagues at places like Cardinal Health that are supplying these institutions. I think these are critical people that we should all be in awe of for the job that they're doing, and we should thank them. So I agree with you. Everybody knows a nurse. Reach out to them, thank them. I think that will absolutely not only make their day, but I think also shine some light on what potentially could be averting a mental health crisis by just showing our appreciation for these people and the sacrifices that they're enduring. And then they've got to go home, come home, and then they've got to homeschool their children. So they've got multiple roles to wear as
I
well.
don't know how they're doing it.
I don't know.
I told you I live across the street from the Naples Hospital, and I was volunteering there on the fifth floor. So I went down with my brother, and we made a bunch of chalk art called Hero Zone, and we did it at
Awesome.
night. And the security guard came across, and I thought, oh gosh, we're going to get in trouble for, like, violating public property or something. And he literally said, I'm over here because I don't want you guys to get hit by a car. So he blocked us in and protected us, and then actually took my dog Klaus on a leash so we could finish the chalk art. And he's like, yeah, it's straight. Add a little bit more over here, a little bit more over there. And then the next morning I called everyone on the fifth floor and I said, hey, look out the window in the road. There's a message for you. And they just like lost it. And they were laughing because it was crooked, but what a great story all around. Like, the security guard's not here to get me in trouble. He's here to help me with the art. And then call the fifth floor and tell them to look down. So I tell people, if you got time, especially if you have little kids, chalk art makes them feel like they're part of the story too, and that they're thanking all the first responders. And as you just said, it's food, security, safety, and care. All those people, they all need an enormous high elbow and some chalk art.
A high elbow. I like that. That may be the new international sign for greeting going forward. Certainly no
Yeah.
mistakes. What other lessons have you learned? Have we learned along the way amid the coronavirus pandemic that you think are important that our viewers should know and think deeply about?
I just think gratitude, is a lesson that I got. I still have my job. I have friends that lost their job. One of my best friends lost his dad to COVID. The post-traumatic stress of him not being with his dad, that's going to be with him forever. You don't not get to say goodbye to someone, and he didn't. So I think the big lesson for me in all this, Mario, is just an immense amount of gratitude. It hasn't been politics. It hasn't been pointing fingers. It's just been gratitude that I'm okay. I have a job and I have an ability to help. And so I hope people, I told my students, do me a favor, try and come through this better than when you entered it. Be better, whatever it is. Learn something new, do your best in school, do your GSD, have a sense of gratitude. If you can give back because you can afford to, or you can give your time, if you have a medical license or a background in public health and you could be a track and tracer, do it. Just come through this better and have some gratitude. I really believe that would go a long way for a lot of people.
I think that's the interesting timing for this show in particular. As we've talked about, really, my focus is to inform as well as entertain. And while we have a specific viewpoint for the network, I think it is important to be gracious in every approach. And probably the moment of this interview that I've anticipated since you've accepted it was talking to you about something a little bit more personal. I know we started off on personal health. I'd like to finish off on something a little bit more personal before we have our parting comments. But many of us, as you said, we've lost colleagues, we've lost family and friends, and some of us certainly have seen the passing of some public figures that we admire due to this. Have you lost anyone that you've admired during this unprecedented time? And who were they? What was their influence on your life, your career? Tell us about them. Tell us about this relationship.
Well, I haven't lost anyone directly, but I can tell you that my godmother, who I write about in my book, huge hero to me. I think a lot of my family worked in and around the FBI, and my godmother was a G-man or a G-woman, and she lost her life at 9/11 being on scene down there, and she got lung cancer. She was a marathon runner, not a smoker, and it's widely believed that being down there in the toxic fumes, and there's a lot of data on this. There was actually a lot of debate, and a lot of studies were led by the CDC. It reminds me of the pandemic now. She passed away at a very young age, and her last days in the hospital, I was with her mom, Amy, who's a lot older than her. And now Amy's become like my great godmother, if you will. And this week I heard that she has COVID and she's in a nursing home in New York at one of the hot centers. And I feel powerless that I, could not get her out. And I think of her because that has really become ground zero for this epidemic. And she's 98 years old. And so I'm rooting for her. But it brings it full circle now, doesn't it? She has a daughter, serves our country, dies after 9/11 for being on the scene, collecting evidence and doing her job as an FBI agent. And she would probably just, be so taken back that here we are and her mom has COVID in a nursing home in New York and there's not much we can do to help her except to root for her. So everyone is going to know somebody directly and indirectly. And again, how do we kind of come through this better? What can we, instead of blaming everyone, saying, why is all these people trapped in a nursing home? What can we do better next time? So the generation of McCarthy's don't die every time we have a natural disaster or an emergency or a pandemic. Gosh, I hope I'm not on the next podcast with you to talk about this family going through any more trauma or stress on behalf of our nation.
And our heart goes out, and certainly our thoughts and prayers. It's
She's
a
tough
very
as nails, Amy. She's like, hey, Meg, how you doing? I'm like, oh my God, you're 98, you have COVID. And she's like, I'm doing good. I'm going to make it. Send me your book. It'll inspire me. So I got to, strong as an ox. Gosh, some of these 98-year-olds, they just make us look wimpy sometimes.
It is. They have something that certainly we all long for, and that's perspective and just a little bit more wisdom. So I think certainly things that I aspire to have for both. Let me open up the floor to you for the final word, and where can our viewers follow you, your thoughts, where can they get your book, or where can they follow you online?
Well, first and foremost, you can get my book anywhere. And the only reason to really buy my book, because we basically covered a lot of it, is all the proceeds go to the Harlem Children's Zone. And yesterday, $4,000 from my book went to the Harlem Children's Zone. So every dollar from the book goes there. And right now, those kids don't have food and internet, and they're not in school. And so there's a lot of kids out there that are supposed to be homeschooled, but there really isn't the makings of a home. And there isn't the makings of giving them education and food. So don't worry about my book, worry about them. And if you don't buy the book, go give money to the Harlem Children's Zone. So you can follow me wherever you find Mario. We follow each other on Twitter. We travel in similar circles. I'm on Twitter, I'm on LinkedIn. And I love when people reach out to me. So if you reach out to me, I'll reach back out. If you don't agree with me, feel free to share your data. I love debate. That's how I learn. And I think, Mario, that's what your show is about. And that's the niche that you're going to fill, is that there is some common ground on both sides. And all of us want to do the right thing. So I'm just so grateful you have this show. And I'm honored that I got to be the first guest.
You definitely are. And I am deeply honored and privileged to have had the opportunity to invite you, as well as to have you accept. And this has been an incredible benchmark for us to set for the future. So, Dr. FitzGerald, I am thankful. We are actually, as a family, going to buy a couple of copies of the book, because I think it's important that people understand your story. Having two daughters, I think it's important with their current biological degrees that they are currently seeking, one that will be out of school and heading to dental school shortly. They need to know that they have the ability to do absolutely anything that they set their mind to and ascend to greatness. So I think having good role models, knowing people's stories are important. But like you said, the underlying factor here isn't selling books. It is supporting an incredibly worthy charity at a time where it's most needed. So I'm very, very thankful for you, for your continued efforts, and certainly can't wait for you to come back to New York when it's a bit safer to do so.
I will. And I'll just say on behalf of Klaus and I, he was here for the whole interview. Hug a pet, be near a dog. So thank you from Naples, Florida, Mario. Be well, my friend, and be safe.
Absolutely. Thank you. So for the New Right Network, I'm Mario Nasinovich, and I invite you to follow us across social media at Stealth on Health, all one word, at Twitter, Instagram, and you can see highlights of this show and our future shows on TikTok. Our merchandise store is also now open, so that shop.spreadshirt.com/Stealth on Health, and up until May 19th, you can get 15% off all of your items, and as Dr. FitzGerald shared, you can be the cool, chronologically advantaged person down in the state of Florida by wearing some of our cool merch, as the kids say. And to access this episode and others that are on-demand programming from Stealth on Health, I want you to visit newrightnetwork.com. The right voice, right now. Thank you for tuning in. Stay safe and stay healthy. Welcome to the Healthcare Voice on the New Right Network. This is Stealth on Health with